Oh, the YouTube is still thinking. Okay, now we are live. The picture didn't go there yet. Okay, it is up.
Okay.
All right. Good evening, everyone. This is United Medical ACO, our diabetes program Wednesday wellness webinar. I'm here with Amy and Donna, for our program directors, and we are gonna discuss new topics today with you. So I'm gonna ask each of them to introduce themselves, and then we'll start PowerPoint.
Okay.
Donna?
I am Donna Gunkel. I am the Director of Clinical Integration here at United Medical.
And my name is Amy Wilcoxon, and I'm a registered dietitian and certified diabetes educator with United Medical and with our diabetes program.
All right, thank you. And while we are here, I'm gonna actually just start the PowerPoint, and our program director from the physician side is Dr. Ripu Handal, who is one of our endocrinologists. He's a board member of United Medical ACO, and he has his private practice under First Aid Endo. And we have Tim McCoo, and he's one of our physical therapists. And also Jackie Tomasad is our social worker. So if you are hearing any background noise, that's coming from my dog, not from me. Hopefully everyone knows that by now. But I'm gonna turn this over to Amy from here. And now just one thing that Amy, I just want to remind our patients, I know we are sending the link to the playlist for this event, and also all the old recording that we have. So, and I know that we were discussing the support group, and we are going to include the support group in that templated letters that we are sending. And if our patients are, when they watch this, we want to make sure that they can check their spam folders for those emails, because they are coming from our database. It may not be so clear to them that that's coming from United Medical ACO. So that's just a reminder for them to kind of check their spam folders. But from here, I can, did you want me to take this, take the keyboard, or would you like me to just use?
I can, so whatever's easier, if you want to go
Okay,
through.
let's try and let's see what happens. And okay, so I'm now going to give you the mouse from here, and I won't touch the mouse, so then it won't mess up.
Okay, all right, so thank you. So today we are going to talk about mindful eating, which we've talked, if you've watched any of our other quick tip videos, we do have some quick tips on diabetes, but we're going to get more into detail about what is mindful eating in terms of diabetes. So what are the skills? What's the difference between being physically hungry and emotionally or psychologically hungry? Some exercises we use. And at the end, we are going to practice. So if you would like to join us and do this exercise at home, you're going to need 4 separate pieces of 4 raisins or 4 pieces of chocolate, which is what we have tonight. So that'll be at the end. All right, so I should be able to advance, right? There we go. Okay, so mindful eating. Don't know why I have that. There we go. Mindful eating involves the development of awareness when eating. So paying attention to food. If you think about how many times you eat on autopilot, so you're sitting down to eat your lunch while you're working at your desk, You're getting your breakfast together, either while you're driving to work or you're watching TV and you're eating. You come home and you open something and you're eating it while you're cooking dinner. So are you paying attention to what you're eating? Are you paying attention to why you're eating? Are you paying attention to how you're eating? Are you enjoying what you're eating? Probably not. If you're doing something else, your mind is split. So with mindful eating, it's not dieting. It's not a specific, we're going to count carbs or count calories. We're not cutting out any food groups. We're just paying attention to what we're eating. And mindful eaters are aware of what they're eating and why they're eating. All right. Sorry. I don't know what's going on here. Okay. So why do we use this with diabetes? So there's actually research on mindfulness and diabetes. So the studies are mixed. On A1C in particular, some do not show a significant change, but there are quite a few studies that show significant increase. I believe this is because the studies that mindfulness and eating show a decrease in weight and a decrease in binge eating. So it can help with symptoms of depression, anxiety, quality of life. So if people are paying attention to what they're eating and they're mindful and they're practicing in this, it really can help control binge eating. So if somebody's binge eating and overeating with diabetes, their A1C is going to get better. So there is research, a lot of research on this topic. We're seeing more on mindful eating the last 5 or 10 years. It's become more popular. It's something that requires patience. It's not something that's going to improve your A1C overnight. And it's something that requires practice. So it's not something, all right, this meal I'm going to eat perfectly. I'm going to eat a controlled amount of carbs and calories. It's hard. So but I think it's worth it in the long run. All right. So characteristics of mindful eaters. So what are mindful eaters doing? And I should have said in the beginning, this is a snapshot. So mindful eating, like you said, is a long process. So this is just the very tip of the iceberg. There's a lot more to it. And actually, we're going to talk more about it in our December webinar. So characteristics of mindful eaters, they pay attention to their food. So I ate a salad tonight for dinner. I know, dietitian, I should have had something not so stereotypical, and actually a chicken in it too. So I had my salad tonight. And actually it did have my favorite mini cucumbers and a good homemade dressing. So as I pay attention to those mini cucumbers, how do they taste? They're so sweet. They're so crispy. I really like them. So paying attention to the taste, the texture, how juicy they are on my tongue, the temperature, they're cold. The smell of it, one of my cucumbers don't smell like a lot, but the dressing. So imagine that your mouth is like a magnifying glass. So really paying attention to that taste, which we're going to focus on our exercise. And then, is this something I want? So if you're having a snack, let's say that you get home and you pour yourself a bag of pretzel or a bowl of pretzels, and you sit down and eat them with your phone, and you're scrolling through your email as you're eating your pretzels. You're not paying attention. You're not being mindful of all these characteristics. Would you eat that whole bowl of pretzels if you weren't doing anything? If you were solely focusing on that bowl of pretzels? Maybe not. You might be bored. You might have other things to do. Or you might realize, these don't taste that good. I don't know if I really want them. But if I'm focused on my email or whatever I'm reading on my phone, it's a good chance I'm going to finish that bowl. And it's the end of it. So I wasn't paying attention to that last one. Is this something I really want? Oh, I lost my arrows. Come on.
That was my fault. I was trying to
take it from me.
I won't touch it again. So here.
All right. Thank you. So paying attention to the process of I was eating, as you were saying. So think about, how do you eat? Think about your meals. Do you eat breakfast, lunch, and dinner? Do you eat snacks? How do you eat? Do you eat at a certain time? Some of these things are going to be out of your control. So if you're eating lunch during the workday, it might have to be at a certain time of day. I don't have a lot of time. I like to walk at lunch, so I don't have a lot of time to eat. So I don't get this great, wonderful time where I'm going to sit down and absorb all my food, because that's the order I like to do things. So that's my choice. But other meals, when you're sitting down for dinner, or if you're sitting down for breakfast or a snack, what are you doing? So are you paying attention? Are you sitting down? Are you eating in the car? Are you eating at the counter? Are you eating standing up in front of the refrigerator? So even not even the food itself, but the process of how you're doing it, where you're doing it. One of the things we always used to say is, are you eating in bed? Why are you eating in bed? You don't sleep on the table. Don't eat in your bed. So all of your meals should be, ideally, if you have a kitchen table, they should be at your kitchen table. If you don't, if you have a dining room table, if you eat on the couch, and because that's your only place to eat, ideally you're not watching TV. And I know it's boring. I lost my arrows again. Thank you. Okay, so paying attention to triggers. So first we started paying attention to where we are. Now we're paying attention to the why. Why are you eating in the first place? Are you hungry? Is it time to eat? You might eat lunch because it's time. That's your time to eat. If you don't eat it then, you don't get a chance. Same with breakfast. You might eat on your way out the door. Or dinner because it's family dinner time. You might not feel like eating, but you have to cook for everybody else. So, but what else? You come home from work, back to that bag of pretzels. Why are you eating those pretzels? Was it a stressful day? Was it emotional? Are you really hungry because you didn't eat lunch? Did you not eat enough during the day? So I come home and eat that bowl of pretzels. Am I always on the couch with my phone? Is it after a stressful day that I'm more likely to eat? So we paid attention to the where, now we're in the why. And you want to check in with that before you start eating. So we're going to get into that. Am I hungry? Why am I eating? And these are the skills that we use to do this. So awareness, what's going on? We talked about that. Observation, what am I doing? What do I see? And being in the moment. So I'm not here eating. I'm focusing. Okay, where's my food? I'm mindful. Is it calm? Is it very frantic here that I'm getting food in and there's people yelling in the background and there's stress and the TV's on? I just want to eat. Non-judgment is a big part of this. Mindful eating does not work as well if you're saying, oh, I can't believe I'm eating all these pretzels. What am I doing eating these pretzels? These pretzels aren't good for me. There's no good or bad food here. It all becomes into is it fulfilling a purpose? So it might not be helpful, but it doesn't mean it's bad. Letting go of the negative with that, letting go of the emotional part of it, except for the being able to enjoy your food, and then acceptance. This is what I've chosen to do. How can I make it better for the next time? So getting back to awareness, this is the cornerstone. This is the first part. When we do our December webinar, we are going to do yoga and meditation. That is our December webinar. So Kemal and Donna, you got 2 months to prepare for that one to get ready. So meditation is part of mindfulness. So as I said, this is just a snapshot. We're not going to work on meditation tonight, but practicing meditations and mini meditations is a big part of awareness and a big part of mindful eating, because you want to pay attention to everything around you. So a lot of times with mindful eating, we do start with mini meditations well before we get to the eating. So it might be that you started the morning with some meditation on breath. We're not going to get into those tonight though. So if we've jumped ahead in the curriculum to just the eating part, we start with my calm, focused attention. I've tuned out all the noise. So right now I'm in a quiet space, but there could be cats fighting any minute. So I'm tuning that out. Calm, focused attention on my food. So what do I hear? I hear the heat. Well, not the heat, probably the air conditioning. What do I see? What do I taste, touch? How do I feel? So we talked about, am I hungry right now? As I'm starting to eat, am I starting to feel full? So we've talked in the past about the blue zones, those healthy regions around the world where people live the longest. And one of them in Okinawa, they have a saying before they eat where they appreciate their food, and they only eat about 80% of the food on their plate, as that is this is what all I need to nourish my body. So paying attention to that. I usually will say stop halfway through and see, how do I feel? Am I still hungry? Am I eating just because it tastes good? Do I need this food? And checking in with what your body needs. getting to know the habits that derail you. So where is your downfall? So I know after a particularly stressful day, if there's a lot of arguing, if I haven't gotten a lot of sleep, I might be more vulnerable for extra snacking when I get home. And that might be a time I'm wandering into the kitchen after work. I'm not typically a nighttime eater after dinner. Some people are nighttime eaters. After dinner, they're cleaning up and they're snacking as they go through. So if you know, well, okay, when I'm making lunches after dinner, that is my snacking time. Well, maybe I can make lunches at a different time. Maybe I can make them when I get home. Maybe I can have a cup of tea while I'm making lunches, so I'm less likely to snack. Because if I'm eating cheese or goldfish or fruit as I'm making sandwiches or lunches, I'm not necessarily in the moment because I'm just mindlessly eating them as I prepare lunches. So observation, again, we're not changing the experience with observation, we're watching. So if we go back to that lunch scenario, I'm just watching what happens. Okay, so I eat a piece of cheese, let's say, as I'm making sandwiches. Am I thinking about it? So did I think about, oh, that's cheese, I want to eat some, or did I just eat it out of habit? What am I doing? And that's going to be my first step, is paying attention to my thought process in this and cues for that. Is it, do I get it out and I just eat it because it's become habit, or do I get it out and think, oh, that's delicious, I want to have a piece? And what's it doing for me after I eat it? So being in the moment, think about things that are automatic for you. So if you drove home today from work, were you paying attention the whole time? Ideally, yes. But do you remember, all right, which light was red, which light was green? I don't know. Our brain can manage all of that. So we're able to do some of this, ideally, again, paying attention while driving, but some of this is on autopilot. And walking can be automatic. We're thinking about other things while we're walking. We're doing other things while we're eating. Because we have these wonderful skills of doing so many things at once, and that's our life. We're watching TV while we're on our phone, we're on our computer. I know my colleagues have multiple screens open at multiple times where they're watching multiple monitors to see what's happened. So we have that skill in our brain that we can see all of that. But when we're eating, we want to try and stay in the moment with eating. So shutting those screens down and paying attention to just that one thing. And that alone will help you focus on the why. And it may slow you down with the eating too. So non-judgment, no thinking, well, I can't eat this, it's going to make me fat. I can't eat this, it's going to raise my blood sugar. Having empathy and compassion to what you're doing. Again, paying attention to the why is going to help you better fix. All foods fit here unless you're allergic. So tonight, again, we're going to be working with chocolate. So everything fits unless you're allergic, no chocolate. So let's talk about physical hunger. Physical hunger is a physiological response in your body. Everybody has different hunger signals. I know my hunger signals are nausea in particular, and I get very irritable or hangry, as people say. Some people have sort of growling in their stomach. Some people have difficulty concentrating, feeling I must eat right now. I have quite a few people that tell me they don't know what it feels like to be hungry. So I want you to learn this skill of hunger so you know when it's time to eat, well, am I actually hungry? Am I eating because I feel like it? So how you can learn this is I normally eat lunch at 12:30 or 12 o'clock, depending on the day. And if I normally eat, let's say those times at 1 o'clock, and I don't eat Monday at 1 o'clock, I assess, how does my body feel? And that's going to help cue me in. My body's used to eating lunch at a certain time. If I'm used to not eating lunch and skipping lunch, chance I'm not going to get hungry. Our body is really smart like that. If I go through the day without eating, my hunger signals are going to shut off because my body does not want to make my brain anxious or depressed because I don't have access to food, which is all it knows. So those will shut down. But if I'm used to eating at a certain time, I'm going to get hungry. And not everybody has these symptoms. So it's good to know what your symptom is. You might have, I've had a sinus headache today. It doesn't mean I'm hungry. I just happen to have a headache. So knowing what those symptoms are of hunger and writing them down if you need to, practicing so you know what it feels like. And then emotional hunger is different. So those symptoms, those irritability or lightheaded, feeling empty, feeling like you have to eat, nausea, it builds very gradually. So at 11, I might start thinking, I think I might want to eat. 11:30, 12:30 comes by. Oh, I feel really sick to my stomach. I got to eat now. I'm hungry. So I may not have eaten breakfast since 7:30 in the morning, 7 o'clock in the morning. So it's been 5 hours. So I'm hungry. And then when I eat, those feelings will go away and I'll be satisfied. Emotional hunger is a little bit different. So I could eat my lunch at 12:30 and I had a very stressful situation at 1:30 and there's arguing and oh my goodness, and I get a call that a bill is overdue. And all of a sudden I want to eat. I'm in the chocolate, I'm in the chips. And all of a sudden I want to eat all the time. So it's unrelated to time. It doesn't matter if I'm full. I just want to eat. And then after I eat, I feel guilty. I can't believe I ate all that. It's terrible. That's emotional hunger. So when that happens, say I get the call, I find out I haven't paid this bill, I'm in trouble. And my first thought is, oh, I want to go eat something. I need to stop and say, wait, halt. I'm going to get into that. Am I hungry, angry, lonely, or tired? Why am I eating? Am I actually hungry? And if the answer is no, I'm not, I just ate, then I got to go do something else. If I'm at work, I should be working. If I'm home, I should have a list of things to do besides eat. So it might be go for a walk. Maybe you can't leave your house because you have small children at home or you have somebody who's depending on you at home. So you paint or you draw or you do something that uses your hands so you can't eat. Knitting, coloring, digging in the dirt, gardening. Take a bath or shine your shoes. I don't know who does that anymore, but people probably do. Iron your clothes. So lots of different things. So when you're eating, let's say I go ahead and eat, stop and ask yourself, am I hungry? How does my stomach feel? Is it satisfied? Pay attention to what's going on in there. So here's our halt. And there's a lot of other things. I'm a procrastination eater. If I'm supposed to be doing the laundry or something, I'm more likely, but P doesn't fit, then it doesn't spell halt anymore. So you could be a boredom eater, you could be a sad eater, but it doesn't make the word. So we just use the word halt. Are you hungry, angry, lonely, or tired? So if your answer is angry, lonely, or tired, you should not be eating. If you're hungry, think about it. What do I want to eat? What am I in the mood for? Think about it. So ideally not going to shove in what you find first thing. What do I feel like eating? Do I want this or do I want this? Preparing the food, putting your food on a plate, a bowl, wherever it should be. You should be sitting down at that table. I apologize. There's a cat scratching in the background. If you hear that, it's the cat distractions tonight. So your setting is comfortable. I'm eating slowly. I'm pausing partway through. So a lot of people, when they eat, I didn't bring a fork down with me, pretend my pen is my fork. So they're eating, they're loading up their fork, they stick it in their mouth. As they are chewing, they're loading up their next bite to stick in their mouth. So ideally finish chewing before you load up that fork. That's going to slow you down so you can listen to those cues. Do I still feel like eating? And there may be days, let's say you go out to eat and you get this big sandwich and it's really, really good. And you eat half and you follow directions, you stop and you think, I could be done. But you might think this sandwich is really good. I don't want to take it home and eat the rest tomorrow. I want to eat the rest today. That might happen some days. And if that happens occasionally, that's okay. If it happens every day, you're going to throw your hunger and fullness cues out of whack. So you want to pay attention. Remember, you get to take that other half home. It's always going to be there. So I usually will say, if you're in some like special cafe in France and you're never going to see that food again, you should enjoy it. But if this is something you could get anytime, take it home. You can eat it the next day. It's always going to be there. All right. So mindful eating with diabetes, how to implement this. So 10 to 20 minutes of sitting meditation. We're going to work on this in December. And there's also a lot of meditation online. So there's apps. I think, Kemal, you have a meditation app that checks through your ring.
Well, I did, but it's not connected to the Bluetooth. So I'm not using it for a while, but I got the second replacement, waiting for the third one.
Oh, okay. All right. And what's the name of that app again?
It is
Is it Aura?
Aura.
Okay.
Aura.
Aura.
O-U-R-A.
O-U-R-A, not A-U-R-A, so Aura. Okay. So that is definitely something that you can use, that app, as long as other free ones out there. Meditate is one, Headspace is another one to use to practice. There's a lot online too, focusing on breath, 10 to 20 minutes. So this is one way that you can start before eat, a mini meditation. So focusing on my breathing as I'm slowing down, counting my breaths. How hungry am I? So as I'm counting my breaths, I might picture my hunger level. So sometimes I picture in my stomach, I think about my stomach like this. And I think if I'm really hungry, it's empty. So it's just this empty block. If I'm only a little hungry, maybe it's halfway full with something. And if I'm really not hungry at all, I picture it all the way full. And then I imagine like, all right, can I slide anything in the top of there? Can I fit anything in there? And I might think, no, I like to think of it really full when I'm full. That nothing can squeeze past whatever's in there. So I imagine that as part of my meditation, trying to get things in there. It's not something that I would enjoy doing. But if I'm hungry, it's empty. So I think about, what do I want to enjoy getting in there? I'm going to pause mid-meal and I'm going to think about, all right, what does that stomach look like? How full is it? Is there still a lot of room in there? How do I feel? How does this food taste? I might still have room in there, but I'm really sick of this food that I'm eating. And then pause again after eating to assess your fullness. Check again in a few hours. Are you still full? Then that's something too. And you can check also with your blood sugar. So I'm pretty full. How's my blood sugar after this meal? Did my blood sugar also do well with it? Is it a win-win combination? Or am I really hungry an hour later and my blood sugar's through the roof? It's not a win-win combination. So using that outside knowledge in addition with your internal signals. Are you taking away my, here we go. I lost my arrow, sorry. So implementing, I spoke ahead a little bit. So again, the list of alternative activities to eating. I used to give lists out, these written lists for people to give them ideas, but now I tell people to make their own list, make it in your phone. So you always have it. And you want to have something on there that brings joy. So it's something that should make you happy. And that's why I don't give out lists anymore, because I want people to find their own lists. It also has to be flexible. So I would love to go to the beach. That would bring me joy. That's not practical. I live in Bear, Delaware. The beach isn't that close. So what can I do that is practical, that's going to bring me joy? Maybe I can look at pictures of the ocean online. Again, checking your blood sugar before a meal and 2 hours after a meal. So using an app, if you're logging, you can put in the notes in there, or using a journal to record and note the relationship with hunger or fullness. So again, is there a relationship? If your blood sugar is really high, is that when your stomach is really, really stuffed? And probably, yes, if your stomach's really stuffed, your blood sugar probably is higher. So paying attention to that, how do I feel? It's not good for my blood sugar, and I don't feel good either. And we're going to notice the changes in taste while you're eating. And that's with our exercise that we're going to do tonight with my captive audience out here. All right. Are you two ready?
Yes. Hey. Should we stop sharing the screen for a second then? How are you doing? Because they won't see us.
Well, let's look at this and then we'll take the screen off. Okay. So what we're going to do is we're gonna do some breathing. I'm gonna have them to pay attention to what they're doing. We're going to look at food. So we have chocolate. Everybody has chocolate, different types of chocolate. We're going to be paying attention to texture, color. We're going to eat it, and we're going to see how the tastes change. And now, yes, now you can take it off.
All right, so I heard a lot of blah blah, yes, KE. So I need you to repeat those one more time.
Oh, we'll do it together. It's okay. That was just a quick summary in case anybody was going to do it at home. Okay, so what I would like you to do is take 4 pieces of chocolate. So I broke mine up, so they're about this big. 4 pieces of chocolate and spread them out in front of you. Now, if you're doing this at home, you can do it with just, so you want to open one bar, whichever one you want to eat, and then just spread it out.
Same kind, right?
The same kind, yes. You can't open both bars. You can just have to save the other one for later.
Okay.
So you should have, so I have 4 pieces spread out in front of me.
Yes.
There we go. Right. Don't feed your pets chocolate.
Okay.
Hope my cat, no chocolate. All right, excellent. So everybody's ready. Okay, so now you do not have to close your eyes on camera, but I do want you to take a few deep breaths, and I want you to look. I want you to calm, in case you're feeling not calm, because we're in the middle of a webinar, so you might not be, but try and feel calm. I'll give you a minute to do that. So I'm focusing on calming. Okay, so now I'm picking up 1 piece of chocolate. All right, so don't bite it. So take a look at your chocolate. What does it look like? So you don't have to answer. Notice the size, notice the texture of the chocolate. So I noticed mine is kind of crumbly. It's not very evenly. I didn't break it apart very evenly. You can smell it. What does it smell like? It smells like chocolate. So if you notice any hints of anything else that's coming with it. So if you put it on your lip, don't bite it, put it on your lip. How does it feel? So we're getting all of our senses, our smell, our touch, our taste, our feel. All right, and then what I want you to do is I want you to either take part of it or just take that one piece, and I want you to put it on your tongue for count to 5 before you chew it. So just hold it on your tongue. Okay, so go ahead, stick it in your mouth and then just hold it on your tongue. Thank you for being willing to do this. So once you count to 5, I want you to move it around a little bit with your tongue and notice, how does it feel? How does it taste? And so if you've gotten to 5, then you should be starting to chew. And is the taste changing as you're chewing and it's moving around your mouth? What part of your mouth are you using? Are you using your back teeth? Are you using your front teeth? Are you using your tongue? Are you squishing it around? Do you want to swallow right away and eat another piece? Are you letting it hang out there for a while? Are you really sick of this chocolate and getting thirsty? So I want you to think about what's going on there. So you want to keep chewing until every delicious bite of it is gone. And then once it's gone, swallow it. And then, do you still taste it on your tongue? Is it still there? It's chocolate, it should be, it kind of goes in there. All right, so we're gonna do this with the other 3 pieces. So now I want you to take them, but not all at the same time. So I want you to take the second one. And so again, hold it, smell it. Is it the same? Is it tastes the same, looks the same? And then it should, it's the same chocolate. So again, stick it on your tongue, count to 5, and then start to move it around and start to chew it up. And what I want you to notice is it the same as the first? Now that you're chewing it, does it taste exactly the same? Are you getting that same hit of chocolate on your tongue? Are you getting a different taste? As you move it around, is the taste changing? And you can go ahead and move your third when you're ready. Don't rush yourself. When you're ready to swallow. As you go on, I want you to, I'm going to stop talking for a minute because I want you to think about what you're thinking about. Is this stupid? Why am I doing this? I don't even like chocolate. I don't know what I'm supposed to be thinking about. Are we going to be done with this? I need water. Where does chocolate come from? I wish I had bought a different kind of chocolate. This is very dark chocolate. which is if I was eating mine, that's because mine's 72%, not my favorite. So I might be thinking, I don't know, maybe I want more chocolate. Should I buy Halloween candy? Maybe I should buy this kind of chocolate for Halloween candy. So think about what does this chocolate make you think about? And again, that third piece, I want you to mindfully move it around, mindfully chew it and swallow. Don't start your fourth one yet, though. And now I'm not even having chocolate, but I'm going to drink some water.
It is rude.
It is rude. All the talking was making me thirsty. All right. You can raise your hand if you're on your third one.
I just finished mine.
Okay, so finishing your third one. Okay. So now we just have the fourth one left. So now what I want you to do is you look at your fourth one. I want you to say to yourself, and so this is going to be a little bit different for you too, because I asked you to do this. So if you were on your own, the first thing I want you to think about is, do I want this chocolate? Now I'm asking you to do this, like, Amy, I don't want to eat this chocolate. I want to be done with this. So, but if you were doing this because you really want to eat the chocolate, I would want you to think about, do I really want to eat this? Is this tasting good? Is it worth it? Should I just wrap it up and save it for tomorrow? And ideally you don't make this decision ahead of time, because if I had all my 4 out and I decide I'm only going to eat 3, I'm not being truly mindful, because I'm making that decision before I checked in with my hunger and my fullness signals. And if I really want it. At this point, I might be sick of chocolate because I got all that chocolate stuck in my tongue and I want to move on to a different taste. So if you decide to go ahead, which I'm going to ask you to do, I want you to notice that I want you to really highlight the difference between this one and the first one in taste. So go ahead with the same exercise that you did. And then we're going to talk about, hopefully, Donna, you have some water there too. So good. We're going to talk about your thoughts as you got through this.
You're going to eat this too?
Yep, go ahead. If you choose to eat it, you can always say, I don't want to eat it.
So, I mean, I didn't know what you were getting into, but I can just tell you without really thinking, influenced by what you were saying. But right now, like I have like this rich taste in my mouth. It's almost too much. I feel like, so like, I don't know if I want to have another
Yes,
piece.
that's good. You don't have to have the fourth piece. So that is part of that, that mindfulness.
Yeah, right now it's still there. Like it feels like if I'm still eating, and that makes some sense now.
Well, good. That's really part of the purpose. And the other thing too, and I know Donna's still eating, so she can answer this when she's enjoyed her last piece, is when you took that first bite to your last bite, did the taste of the chocolate change?
I thought my first piece tasted, is stronger the best word? I thought it tasted more bold, I guess. As it went on, it was kind of like, okay, yeah, same old thing. But the first bite was like, ooh, chocolate. And I'm like, Kemal, I mean, I still taste it. But I do think that the first bite was a little stronger, I guess, or more bold flavor than the last one. But maybe it's because I was getting tired of eating it at that point.
No, you get a gold star. That's exactly what's supposed to happen. So studies show, and this has been studied, is 2 things. One is that when you eat a food, you only taste it the first 2 bites, and then your taste becomes sort of numb to that. And people just eat for the enjoyment of eating or the social part, but you don't taste it as much. So you're absolutely right. You get that punch of chocolate, and then why are you still eating? Now you got to eat a meal. So I wouldn't expect you to just eat 1 bite and be done.
I have a question, Amy. So, as you were explaining this, how you said don't drink water. Now, what we advise during the dinner or while we are eating, not to drink too much water, right? So does that have something to do with the taste? Because right now I really want to have water. I want to drink water.
You can drink water now.
No, the thing is, I guess it may wash the taste out. So it's almost like it makes a little bit more sense not to drink too much stuff while you're eating. Is that?
Well, I don't know. So I don't tell my patients not to drink water while they're eating. That's only bariatric that we tell them to drink. And that's because, the pouch. They have to fit food in there and not get full on liquid. So that's the separation. So I think, there's a good point in what you're saying, because if you drink a lot of water, you're potentially going to wash that out, and then I can keep eating. But I also think I'm a strong believer, as you both know, in eating how I want to eat. So if I have all this really dark chocolate in my mouth and I need some water, I would think it's okay to drink. But if I really want to focus and eat mindfully, I think part of that practice is knowing that I'm going to drink water, not as an excuse to clean my palate to eat more. Just as part of it. That's a really good point. The other thing I want to talk about, and this specific to this exercise, is especially because Kemal, you had the 72% like I did. One of the reasons I will admit I do prefer milk chocolate, even though dark chocolate's better for you. I recommend dark chocolate, not necessarily because it's not a health food. It's not that much better for you, because it is so savory. It really does stick on your tongue. So people tend to not eat as much of really rich dark chocolate, because, as you said, it almost stains. It's really stuck in there, and
it's still there.
And it's a really strong taste. So I think that's probably part of this original exercise, which I've done multiple times at conferences and with patients. It's actually done with raisins. I'm sorry, there's a cat fight now going on behind me. I apologize. I would break it up, but hopefully it will be fine. They're not engaging in mindful eating, apparently, and they can't have chocolate. So any other comments or thoughts or questions?
I have maybe more from the overall, the kind of like the generic side of this. Now, I use the word meaningful a lot, like doing stuff for the way that it should be meaningful. Whatever you are doing should be meaningful, or the impact you have should be meaningful. Like we were at, Don and I and our leadership team this morning, we were at YWCA, and even from the charity side, what we like, when they ask me why we work with them, I say because there's a meaningful impact. So like the mindful and meaningful kind of, they're very similar almost, maybe. I don't know if they're identical, but they're very similar in the way that we use. So things get more, maybe more important, or more, the value is kind of like changing as we are paying more attention. It's not just the eating only, right? So it's almost for everything else, because like when I was trying to just promote the event while you were presenting, I had to pay extra attention in case you mentioned my name, but I wasn't paying full attention. So then what you are saying could be lost in the, in the way that while I'm trying to really help the event, at the same time I'm losing my focus. So like same thing with that, like sometimes I see our, including myself in some meetings, we are on our phone and we are doing a lot of stuff, and then the meeting becomes less meaningful. If you are with your doctor, if you're not listening, if you're paying attention to something else, everything becomes less meaningful if you don't focus. So, and I think that's like one of the main maybe takeaway from this, even for someone like, in our group, so we speak and we present these issues, like if we are not saying that we are the expert, you are, this is your field, but Don and I, we are not nutritionists or dietitians. So, but we try to, like, from this session, like from what you are explaining today, my again, takeaway is, okay, so I'm going to have dinner today, but then I need to go to the basics to see what I'm missing. You know, one thing that maybe sometimes I may be overanalyzing this, but I do drink hot tea during dinner, and that's kind of a new habit, but that may have a stronger washout impact on my tongue when I'm eating. So then I may be, like, because water is not going to take the taste away altogether, but something warm it's going to. So, like, just to process it a little bit more. So, you know, the other day I was actually having dinner with Dr. Erkan, and when we meet, sometimes like he's not eating right away, and then I'm about to start, and then I realized that he's actually admiring the food first in his mind, and then he said it does increase his appreciation to the food, so then he's putting more meaningful. I guess he's eating in a more meaningful way when he's doing that. So it makes a lot of sense.
It's something that's present in a lot of cultures, is taking that. In some cultures, it's grace, you know, and saying thanks and saying grace. Some it's stopping to reflect and be grateful for this food I have. So a lot of our patients, and we hear people talk on nutrition, especially with weight and diabetes, that food is this battle. But I really believe that food is this gift that we're giving ourselves to nourish. So as it's a gift, we should be appreciating this beautiful food that we have and thankful that we have to eat it. And yes, and exactly as you said with Dr. Yurgo, it slows you down and makes you pay attention to what's on your plate. I also believe in that before you even choose or cook, that you should be thinking about, what do I feel like eating tonight? And it may not be it might be oatmeal for dinner or salad for breakfast. And that's okay if that's what you want to eat.
And, you know, it's like saying from the same way that you are explaining. So even for the way that we did our gardening, right? Mm-hmm. So when you know that you are the one who's putting the effort, mm-hmm. So then you appreciate it more, so that you don't want to just consume right away. Mm-hmm. So you exactly. Just like that little tomato is more meaningful now. Like, okay, because it's yours, so you know how long it took. How long it takes to actually raise it from the time that you plant it. So I think we sometimes lose that connection with just like everything else with food as well.
I know, I agree. And I think taking that work you did in your garden, because you're doing that work and appreciating, and it's nourishing the land, mm-hmm. and nourishing your body. And you're right, I think you are more likely to baby that food and appreciate that food because you grow it. You put the work into it yourself.
Well, and the other thing you were talking about was, you know, paying attention to it. And I think because now with all of the different technology we have, right? Growing up, I didn't have this kind of technology. We only had the phone on the wall. So we weren't allowed to answer it at dinner. Whereas now everybody has their iPads, their phones. We're constantly multitasking. And so I think we do have to be more mindful to put those things aside, to your point, and pay attention to the food, because we do tend to try to do many things at one time. And if you're doing all of those other things, then you are eating without thinking about it.
Right. And if I have my watch, I get notifications on my watch. So on my text, I mean, I might have my phone over there, but maybe I should turn the notifications off of my watch.
Mm-hmm. Yeah, that's actually like, again, like from every different setting, what we are discussing on the mindfulness is applying to everything that we do. So, and it makes more sense. So understanding the issue of, like, it's not your stomach actually is the one that's hungry, it's your brain is telling you, and it needs to communicate. And, you know, it's, I guess the problem may be sometimes the challenges, and this is true for our patients as well. So sometimes we know the right way, but then doing the right way is not easy.
It's not, and it's not what you always want to do. And I think, you know, I know what I'm supposed to do. It doesn't mean I'm always doing it either. So it might be, I know I'm not hungry. I shouldn't be eating this chocolate ice cream, but I really want it. So I'm going to do it anyway. And I think, you know, if that happens sometimes, but it's does that become the majority of the time I can focus and be mindful? And also too, as part of mindful eating, I'm allowed to have chocolate ice cream. I just, if I know I can have it every night, I'm paying attention to how much, and then I don't want it every night, ideally, because I'm listening to my body.
Super. All right. So, did we have any other items for tonight?
No, so that was everything. Just upcoming, we do not have another meeting in October. Our next webinar is November, I think it's November 8th. It's November 10th, and that's with Dr. Hundle. We're going to be talking about medication. I'm going to do a short focus on food at the end about soups and stews, but he's doing the last medication section, the last part that we haven't done. And then we'll announce then our November support group, that date.
And Donna, if we can actually start making that adjustment on the letters that we are sending for support group, so then I think we can also make that, because we are sending it to patients with A1C over 7 to 9, they get one letter. If they're over 9, they get the high risk level.
So we just want that as an addition, not a separate one, correct?
I think it should be a separate one, because even someone who's managing, they may need that support group one. So then we can include it in the regular diabetes one, but then we should have one for just for the support group. So I think it would increase our activities.
Sure, and I'll talk to Tanner as well tomorrow, because I know we usually set a separate, we create a special link each time for that. So I'll just need to talk to him about how we should do that. Or maybe we can just have them contact care coordination if they're interested, and we can put their name on a list and send it to them. Sure. Or we can have them register through the portal as through QuickBase as well.
All right, that sounds good. Well, thank you so much for being with us tonight, and hopefully our patients are getting these videos and they can also watch and learn. So we are here again next month. So thank you for being with us. Good evening.
All right.
Thank you.
Good night.